Farhad, take a look at your letter.
Yes, ma'am.
Okay, so from the date to the date of birth, is it ready? It's going to be 15th June 2018. And we are writing to Dr. D. Kurak, the Weight Center, Victorian Road, correct? And Dr. Kurak. Okay, so Dr. Kurak, comma, reference, oh sorry, regarding Mr. Andy Williams, age 65, correct. I'm writing to refer Mr. Williams, who's obese. Assessment and management from your facility. Well, you are going to tell me, see, when you're writing a letter, keep these three things in mind. If you want to know what relevant details has to go into the letter, then you'll be looking at the purpose. Answer these three important questions. Basically, first would be, uh, what is the patient suffering from? Okay, so with regard to that, when you look at the discharge plan, and then when you're assessing these, you'll get to know. And secondly, you're going to talk about whom are you writing the letter to. So for what purpose are you writing the letter to? So in this case, this man requires some advice regarding surgery, isn't it? So we are going to keep that in mind. And here you're going to tell me that he requires further assessment and management. No. So for her, it's going to be advice regarding surgical options due to
Y-
due to obesity. Hmm. Okay.
y-
So
Yes,
that will be in our first paragraph. I'll frame the paragraph for you, but please check your letters. The others here, please check your letters. Please check your first paragraph, whether you have written this in the purpose. If these specifics are not mentioned in the purpose, then you'll have to change it. It means that there is something wrong with the first paragraph that you've written. Next off, in our second paragraph, Farhad, you have told me that he has been overweight since childhood. So first off, begin your second paragraph with the date of presentation. When was the patient presented? So Mr. Williams presented to our clinic today because we don't have any other date, right? So that has to change. Supported by him. This program, he ends up gaining weight on discontinuation, consulted bariatric surgery because of complications. Yeah. Cause of stress, no. Because of stress. The word is because of stress. Now, I've told you this before also, Farhad. I don't need the specifics of the range that is given. I don't need that. I don't want the insulin levels or anything like that. You can either tell me that it is out of range or that you don't have to be so very specific about it. That goes in the report. So you can leave that part.
yes, ma'am.
And works as a radiologist. You could discuss surgical options with Mr. Williams uh, and recommend suitable treatment. Okay. In case of any queries regarding Mr. Williams, please contact me. Yours sincerely. Why should look like it is in the uppercase, Farhad? Okay,
Yes.
that is done.
What?
Thank you. Next.
Thank you, ma'am.
Whose is this? This is whose letter? Hui,
Ma'am,
are
what
you there?
screen? I did not see it in the
Are
screen
you
which
able to see
you
the
have
screen?
shared. Yes, ma'am, but no, this is not my handwriting.
Not able to see.
The actually it's not changing my uh right now. Perhaps paper is still on my screen, so I don't know which one you showed, ma'am. Tani daw 들어.
So you don't have to necessarily say came to the clinic on 15 June because that is the same date. And the year is the year you've changed the year. It is 2018, not 2010.
Sorry, ma'am.
Gaining weight, not gaining weights.
Yes, ma'am.
That can occur full stop. I need you to punctuate it. Has a family history of obesity? Well, here you're going to tell me Mr. Williams has a medical history of type 2 diabetes, hypertension, and sleep apnea.
Yes, ma'am.
Works as a radiologist and is recently diagnosed with what? That's incomplete.
No, ma'am. This one I wrote wrong and recently divorced.
Divorced. Okay, sorry. Read it differently. Next, it would be greatly appreciated, comma. Have you placed a comma after appreciated? No.
No, ma'am.
The care his requires, the care he requires.
The care he requires, ma'am.
Well, it is not care that he requires. He requires education pertaining to the surgery.
Yes, ma'am.
Okay, care
Yes,
is not the
ma'am.
word we are going to use here. So you have to be very specific when it comes to vocabulary.
Yes, ma'am.
He has already been evaluated for obesity. So there's no need of stating that. You just have to talk about, surgical
Treatment
interventions here.
options.
Hmm.
Yes, ma'am. Ma'am, I am a bit confused in this type of letter because I have not written like this type. So I don't know which one should be the first, the second and third. I know the third paragraph is always the history, but usually because it's all about his weight history, diet history, those things. So I don't know which one to write in the second paragraph.
Second paragraph.
Yes, ma'am, because like usually it's mainly because it's usually medical conditions and all those things. But here it's all about his history, diet, weight history, diet history, and also I was a little bit confused with this type of letter.
Okay, I'll just tell you that when I'm giving you a sample. I'll just discuss it in detail. Let me quickly look
Yes,
at what your friends
ma'am.
have also written. I'll tell you that, no problem. I hope you guys have taken prints of
Yes,
the
ma'am.
sample
Yes,
sheets.
ma'am. Thank you, ma'am.
Welcome. 65 years. Well, is this Moi's letter?
Ma'am, mine.
Sorry, can't see you. Who's this?
Dusaki, ma'am.
Dusaki. Okay, Dusaki, see, I think you've punctuated after June. I want you to erase that. And I need you to place a comma after Curac. And I see a full stop after Williams and 65 years. Erase it.
Yes,
I'm
ma'am.
writing to refer Mr. Williams, comma, who has been suffering from multiple medical conditions. Well, no, that's not what we are talking about. Be specific. It is not multiple medical conditions. He may have multiple medical conditions. Listen up, everyone. Even if when a patient has multiple medical conditions, there is a reason for them to have, to present themselves in your clinic or in the hospital. One is either because of the multiple medical conditions that they have or for a specific problem. In this case, it is for obesity. Okay, and for surgical, they require advice regarding surgical interventions, isn't it? So this is the specific of the case note. So you're not going to be vague and you're not going to tell me suffering from multiple medical conditions. Okay.
Yes, ma'am.
Your center was presented to our colleague today is present. See, the same thing. I don't want you to repeat the same thing in the second paragraph. The Saki's second paragraph is about the current medical condition. And here I want you to tell me when the patient, yeah, you've told me that the presentation. Then you're going to tell me that he has suffered from obesity all these years. That is, he has had obesity since childhood. And what has he done to overcome that? Okay, he has
Yes, ma'am.
consulted dietitians, he has looked at surgical options, but he has been scared of the um, side effects, right? You're going to state that in the second paragraph. Third paragraph,
ma'am.
yes, type 2 diabetes is medication. Okay. What else do we have? This is your letter, right?
Yes, ma'am.
And I don't want you to, cut words. You're not supposed to divide the words. For example, participating. There's no space, put it in the next line. Put it in a new line.
Yes, ma'am.
All these, certain details from here will go in the second paragraph only. Works as a radiologist and was recently divorced. Well, all these things need not be written separately apart, from it need not be cut off from the past medical history. You can just add it there.
Yes, ma'am.
Provide a further management. No, provide further management, but provide, you know, advise or educate him regarding surgical interventions or surgical options. Please, yours sincerely, comma. Registered nurse, erase the full stop. Moi, can you see the screen?
Yes, ma'am.
Mr. Williams, comma. No, the first paragraph is, you have to rewrite the first paragraph a little. Was presented today, the same things. I don't need the specifics, just the BMI should do. Concerned about complications, full stop. See, the paragraph wherein you're giving me, the third paragraph, you should always start with the past medical history and then move on to the social background.
Okay, ma'am.
You don't have any off note as such in this case. He will consider surgery. He has tried to consider surgery in the past. Okay, so we are not going to see off note. All of you understand we don't have to necessarily mention off note in each and every letter. Most of our letters will have an off note. Okay, but some letters you may need to write an off note or you may not. It is not mandatory for you to write off note everywhere. And in one of those letters that you've written in the mock, right? I need specifics. In the mock, I had asked for the specifics. And what is it? Off note about the follow-up in 2 weeks with a cardiologist or with a radiologist in 2 weeks or after 4 weeks. So that is how it has to be. So when there are specifics to be mentioned, mention them. You're not going to mention it. You're not going to forget to mention the specifics. All right.
Okay, ma'am.
Okay, so let us look at the letter. I'll start typing the letter now. Give me a minute. Okay, I have, you guys have written from the date to the date of birth, right?
Yes, ma'am.
Yes, ma'am.
Okay, so I want you to dictate the letter for me. Let's see. So from the date to the date of birth, what have I written here? 15th June 2018, Dr. D. Kurak, surgeon, the Wade Center, 393 Victorian Road, Richmond, Melbourne. Can you all see the screen clearly?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay. So, dear Dr. Kurak, you're not going to write Dear Dr. D. Kurak. You're not going to write that. It's going to be Dear Dr. Kurak, comma, leave a line space, regarding Mr. Andy Williams, age 65 years. Done? What will our first paragraph be? I am writing,
Writing
yes.
to refer.
I'm writing to refer, or this is to refer. I'm writing to refer, or this is to refer.
Mr. Williams.
Yes, the new students, the three of you, you can start writing the letter, my sample. You can start writing the sample letter now, the one that I'm dictating. You can write that and then I'll check yours. You can complete it later. So I'm writing to refer, or this is to refer what? Sorry, who?
Mr. Williams.
Yes. Refer, Mr. Williams. Next, comma, Mr. Williams, comma.
Who I wrote,
Who requires
I wrote as who has
advice?
been
I just told
suffering
you
from,
not management and assessment from your facility. Who requires advice?
who
Be
requires
specific.
advice.
Who requires advice regarding surgical
Option.
weight loss options. Isn't it?
Yes, ma'am.
Yes.
Due to what? What
Obesity.
obesity? It says, no, it says he is at the highest of his adult weight. So due to his severe, due to his severe obesity. Due to his severe obesity.
Severe obesity.
Weight loss options from you, comma, due to his severe obesity. Does that make sense? Now, our first paragraph is this. Let me repeat. I'm writing to refer, or this is to refer Mr. Williams, comma, who requires advice. Okay. Who requires advice regarding surgical weight loss options from you, comma, due to his severe obesity. Next, our second paragraph, we are going to say Mr. What? Start. Mr. Williams.
Was presented.
No, when
Was
was the patient presented?
Was
Today.
presented
Always your second paragraph will
today.
start with when was the patient presented or admitted, isn't it? So Mr. Williams
Yes, ma'am.
presented to our clinic today. Due to what? What were his? Due to concerns
About and
about his weight.
No.
About his weight. Yes. Next. You were telling me what? About childhood obesity. Isn't it? Can you frame the sentence? The second, about childhood obesity. What can we say? You can also say that he has been obese. He has been obese since childhood. You can say that, or you can also say he has had obesity. He has had obesity since childhood.
Since childhood.
You can either say this, or you can also say he has been obese.
Being obese.
Obese since childhood. You can say either He's been obese since childhood and has what? See, this man has gained weight every decade. He's now 65, right? Every decade, there's been a phenomenal increase in his weight. So, what do we say for that? He has, sorry,
He has reported phenomenal weight gain every decade.
yes, you can say that. You can also say that. You can also say when there is an increase, rapid increase in in certain durations, then you can use the word exponentially.
Exponential.
He has and has see he has had obesity since childhood, or he has been obese since childhood and has exponentially gained weight every decade. Okay, every decade, and currently weighs. What's his weight? 155 kg. Hmm? 1? Huh. 0.55. Okay. 0.55 kg. Next, what will you tell me? Now, this man has participated in these weight loss programs but has gained weight, regained the weight, right? So you're going, what will you tell me, guys? So give me a proper sentence. Can we say he has participated? I'm just taking words from your case notes. He has participated in commercial and
Several
medical.
weight loss competition.
Yes, weight loss programs. Weight loss programs which have been what? Have they been successful? They're unsuccessful.
No.
Sorry? That is why they are unsuccessful. So you can say which have been unsuccessful due to his discontinuing them. Correct? Next. What shall we add about the dietitian?
A consultant dietitian.
Which have been unsuccessful. That's what I said. Which have been unsuccessful due to his discontinuing them. Full stop. Let me repeat it for you guys. He has participated in commercial and medical weight loss programs, comma, which have been unsuccessful due to his discontinuing them. Full stop. Next, you're going to tell me about the dietitian. Tell me. He, no, not was. He was consulted, no. He
has been.
He has also consulted whom? Registered
Dietitian. Registered.
registered dietitian, correct? And what else are you going to talk about?
He was
He has also
reluctant to
consulted. Been
consider
consulting is
surgery.
continuing still. He has also consulted a registered dietitian and
he was also reluctant to consider surgery due to the bariatric complications.
Let us cut off also and say and has been reluctant to consider surgery because of associated complications. All right.
Yes, ma'am.
Because of associated complications. Full stop. Next. Now he is. This is what is happened. We are because this man doesn't have, you haven't managed the patient in the hospital, in a ward or anything, for you to talk about how he is now. But we have to give, this is just a recent past. What has happened in the recent past? That is, he has consulted dietitians, he has been to these programs, and next he has also thought of surgery, but let go of that thought because of the complications that come with it. Okay, that is what we are saying. Now you may ask me, what about, isn't this past medical history? Well, this is not his past medical history. This is the current history. Okay, that is, these are the details related to his current problem, current condition. That is why we are placing it in the second paragraph under current medical conditions. Got it? Are you following me?
Yes, ma'am.
Then the third
Yes, ma'am.
paragraph, we are going to be specific and talk about the past medical history. That is different. Past medical history is something which is totally unrelated to your current conditions. May be related, but you're going to talk about diabetes or hypertension or some other problem which you've had. Okay, some severe problem that has been affecting your system. So that goes in our third paragraph under past medical history. So we have PMH first and then the SB following. Okay, so associated complications. Then what else do we have to talk about? We'll talk about his dietary pattern. What does his diet look like? His diet regimen or routine. You can say his diet routine includes. What does it include?
3 meals per day.
Second
3 meals
paragraph.
per
This is
day.
in the second paragraph only. That is why I'm using the pronoun he. If it was a different paragraph, I would have used the name of the person, isn't it? Yes, continue the second paragraph. His diet regimen, or you're either going to say regimen or routine. His diet regimen or diet routine includes what? Tell me. 3
3 meals,
Meals
per
per
day.
day.
3 meals per day, of which what?
Dinner.
Of which dinner is the largest.
The largest meal of the day.
Largest meal,
Of the
comma,
day.
of the day. Understood. So limited fast food consumption. And what else? What does he do when he is totally stressed out? Binge eats. He
Binge
binge
eating.
eats. Yes. And give me a sentence, guys.
Binge and consumption, and he binge eat due to stress. One.
Binge eating. Look at the beginning of the sentence. His diet routine includes 3 meals per day, with dinner being the largest meal, limited fast food consumption, and binge eating once a month due to stress. Correct?
Yes, ma'am.
Did you finish writing this? So this is our second paragraph. Okay, this is our second paragraph. And the words that I have highlighted, you're going to use either this or that. And in the beginning also. Third paragraph, past medical history. Mr. Williams has a
Medical history.
medical history of
Type 2
Type 2
diabetes.
diabetes.
Type 2 diabetes, comma. What else?
Hypertension.
Hypertension,
Hypertension,
gout, and sleep apnea.
gout and sleep
Apnea.
apnea. Is the screen still visible?
Yes, ma'am.
Yes.
Okay. What else? About his family history?
He has a family history of obesity.
Sorry? No need.
Family history
No
of
need. I don't need
obesity.
the specifics of the reports, the temperature, blood pressure, nothing. Here I'm being specific only about the weight because we have to mention only that. Here we can't be vague, huh? Medication also. No need of stating the medications or anything. This man has a family history of obesity, right?
Yes,
If
ma'am.
his, he has a family history, or we can just say full stop. His father and sister history of obesity with his, okay, let's just say he has a family history of
Of
obesity
obesity.
with his father and sister, obesity, comma, with his father and sister
Being obese.
being obese. Okay, not obese, being obese. Being obese. Then we'll move on to our fourth paragraph. The plan.
It would be
What do you want to talk about? He's a
greatly
radiologist by profession. He works as a radiologist. Okay, next. This is to convince ourselves that we have written the social plan. Huh? No need of medications. No need of medications. Fourth paragraph, discharge plan.
it
So
would be
you're not
greatly
going one second, guys. Sorry. You're not going to fill in all the details. Whatever is in the case note should not go into the letter. If that is the case, then you can just present the case note as it is. There won't be a point in you writing anything, writing the letter as such. So what are you going to do? You're going to select details, specifics, and keep in mind, it has to be concise. There has to be clarity and it should be concise. The content should be clear and concise. That's the point. So he works as a radiologist. Done. Next, you can start by saying what? What would you want to say? It would
It
be,
would be appreciated.
it would be appreciated or it would be beneficial because we are asking for advice. So I would, my suggestion is if a patient requires
beneficial.
advice regarding surgery or requires advice regarding maybe medications or treatment options, then I think it would be better if you use the word beneficial. It would be
Yes, ma'am.
beneficial. Or you can directly start, it would be beneficial, or you can directly say kindly, kindly provide. It would be beneficial if you could, sorry, it would be beneficial if you could provide, or you can say kindly provide, kindly provide, Mr.
Mr. Williams.
Information. Information to Mr. Williams. To Mr. Williams. Regarding what?
Surgical option.
Surgical options, surgical interventions that are available. Surgical interventions that are available to him. Surgical interventions that are available to him and which are that are available to him. Sorry, kindly provide information to Mr. Williams. Or you can say it would be beneficial if you could provide information to Mr. Williams regarding the surgical interventions that are available to him and which are appropriate for his condition. His general condition. For his general condition, full stop. That's it. We don't have an off note here. Okay. We don't have an off note. Concluding statement.
In case you require further,
If you require further information, I somehow don't like to start, begin with the please if you require further information regarding Mr. Williams, please contact me, or any other concluding statement. Should you require further information regarding Mr. Williams, please contact me. Okay. Or if you have further queries regarding Mr. Williams, please contact me. Then what else? That's it. Stick to one
yours
concluding statement.
sincerely.
Yes,
Yours?
sincerely.
Why sincerely?
Sincerely.
Because the name is
Name is
given.
given. Address
Whose name is given? The addressee's name is given. Guys, I've used
Addressee.
these words when I've explained it to you. The addressee's name is given. So yours sincerely, registered
Registered
nurse.
nurse.
Leave some space. If I leave space here, it jumps to the next page. I hope you have written it down.
Yes, ma'am.
Yes, ma'am.
Is it clear? The ones that I have highlighted, these the words and stems that I have highlighted, you can opt for any one. Not the you should not be writing both.
Yes, ma'am.
Any questions?
No, ma'am.
No, ma'am.
Okay. Joanna, where's your letter? I don't remember seeing your letter though.
Ma'am, I sent
Ah.
it in WhatsApp.
Amazing. You should have told me that.
Sorry, ma'am.
It's okay. I'll check. Anyway, I'll just check where you've gone wrong. I'll mark it and I'll reshare.
Yes, ma'am.
Okay.
Yes, ma'am.
And I will, there's something else that I wanted to tell you. Anyway, any questions? Again, I'm asking you any questions for me?
And ma'am, one thing. Ma'am, can you please check the writing?
Yes, I'll do that.
Yes, that we sent to you last time.
Yes, I'll do that.
Thank you, ma'am.
Okay, welcome. All right then, guys. I'll see you tomorrow with a reading task.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Bye.